it is this one. That's right, homeboy. I'm at Sandra Lee's office. There's my nurse for the day, just in case I pass out.
So I'm just gonna put a little numbing here, okay? So I'm just gonna hold this piece of gauze here and I'm gonna wiggle you. Okay, a little wiggle and a little baby pincher. Oh, that was perfect. That was a perfect sound effect. Do you need to get that?
No.
You sure? I can stop for a minute?
No, I'm good. Continue.
Okay. So what we're doing is I'm just gonna, so what I actually do here is when I put numbing, I let it sit and I just poke with the needle because actually it hurts when you just poke. After that, you don't really feel it under the skin. So if I don't inject it really fast, we usually don't feel it. So if I just sit there for a little while and do it slowly and then start to increase the numbing slowly, it's actually much more comfortable. We're all about comfort in dermatology because most of my patients are awake.
So listen, if I just left this, how big would that get?
It could stay just like this.
Okay.
It could go bigger, but it could stay just like this. But you know, I don't actually even know for sure because I don't know what it is. I'm gonna find out what it is. I think it's a lipoma though. If I had to put money on it, I would say it's a lipoma. But we'll check it. We'll check it under the microscope, and you know, I'll take a video of how it looks like under the microscope and send it to you. You know, we'll put this video together too. You okay?
Yeah.
What does it feel like?
Like you stick it with a needle.
Oh, it does? Does it hurt?
No.
It's not that bad. It's like really feels like pressure, kind of, doesn't it?
No, it feels like a needle.
You don't seem to be complaining.
I have a high pain tolerance, though. I think I do.
You seem to.
You'll find out soon enough.
Oh, he's fine.
No, if I show my leg video.
The machete?
Yeah, she'd definitely say, okay, he has a high pain tolerance.
You've got a machete on your leg? You had it?
Yeah, I accidentally stabbed myself with a machete.
How deep did you go?
Pretty much to the bone.
What?
Yeah.
How did you do that? Were you playing around in your house?
Yeah.
Yeah, I had it out and I was like,
It's really sharp then.
I thought it'd be cool
to use it in a video?
No, I thought it'd be cool to like kind of sword fight with it.
Oh, okay.
And so I was playing around. And so like as I was, like kind of like kung fu, playing around with a sharp machete.
Yeah.
And then thrusting it. I messed up and thrusted it in my leg.
Oh my god. At least you did it to yourself though. Can you imagine if you did it to somebody else?
Yeah.
How bad you would have felt? But it was pretty deep.
Oh yeah,
it was gushing, wasn't it?
Shred. Yeah.
Did you have it on video?
Yeah. Not the actual going in immediately after.
Oh. So you actually said, let me film this. We're going to the ER. Let me film this.
Yeah.
Pretty much.
Yeah.
All right. You have a problem. If that's the case.
I filmed right before and right after.
Are you still feeling pinches here?
No.
Okay. I'm just checking all the edges here, really making sure you can see. I'm putting this is called, when we actually inflate the area with numbing, it's called tumescence, where we actually do it.
I feel those little pricks now.
Okay.
Does your husband work here too?
He does, yeah. He's the doctor here. You can meet him on the way out. He's working.
Okay, so you're in the same office.
Yeah.
You don't get tired of seeing each other all day though?
You know, I don't really see him. Actually, a lot of times I don't even know if he's here or not. I mean, I think it would be really hard if we worked, like if I had to answer to him or if he had to answer to me. But it actually works really well because I trust him. You know, if he tells me an opinion about something, if he says I'm stupid about something, he'll tell me I'm stupid and I don't take it personally, or he says, I don't think you should do that. Like, I trust him, But other than that, if I would go crazy though, if he was ordering me around or if I ordered him around, we would both hate each other. So that's the worst of it, okay? They put a bandage on there.
How are you feeling? How are you feeling? Good?
I'm alright.
That's good. I think this is going to be easier than that, whatever they did when they stuck something up your nose, because that's got to be miserable.
Yeah, and uncomfortable.
I'm going to put a cover on here, and then I'm going to let you finish your paperwork there for a minute.
Okay.
And I'm going to clean it off and get started on you, okay?
Okay.
Look. Boom, 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 boom. It's going.
Are you like Steven Spielberg?
It's just a little soap here, okay?
Might as well do the whole head.
Yeah, we gotta sterilize a good area,
How long have you been working with her?
For 2 years now.
Okay. So you've watched her long enough. Like you could probably do this, right?
I don't think you want me doing this on you.
No, but that was the question. If push came to shove, it's an apocalypse. I got this on the side of my head.
I know, but apocalypse,
Could you
I
do
don't
it?
think this would be your number.
Yeah, I was gonna say if there's an apocalypse, I don't
Yeah,
think
but
you're
I'm
gonna.
just saying, I still won't be cute. Could you do this?
Oh my gosh, I don't know. It'd
Are
be
you-
kind of scary.
But you know what to do.
Like that. Yeah.
Okay, so you can do it.
I mean, I know the steps, but it probably wouldn't be as nice looking as Dr. Lee's. You probably
not,
have a really
not right
funky
away,
scar.
but after a while, you'll get good.
Yeah, it takes lots of practice.
Any final words, Sky?
Stay tipsy.
This side here. So I'm going to cover you here.
Okay.
Turn the light back on again. If you don't mind. See how, yeah, that looks better. Okay. You okay over there, right?
Yeah.
Now I can't see you over here, so just if you if you feel like anything's bothering you at all, you just let me know. You let me know too, because you got like paparazzi on you. You got multiple people. So you shouldn't feel anything, like I said, other than my touching you.
Okay.
It's gonna drive me crazy there. Okay, so I think this is a lipoma. Let's see what we got here. Can you see okay? Is there not too much shine? Okay, okay.
Mm-hmm.
You're doing all right, right?
Yeah, I'm alive.
You can, kind of nice because you can give everybody an idea of what's going on here. Did you talk during your other little surgery? Did you explain to people what it felt like or anything?
No, I was asleep for that one. That was,
Oh, you were?
that
I
wasn't
thought I
part-
saw you sitting in a chair.
No, that was when he was taking out the splints.
Oh, I see. See, yeah, I do think this is a little lipoma. We shall see for sure. But as I mentioned to him before, I mean, it's not uncommon for scalp to ooze a little bit more. We have a lot of little finer blood vessels here, but it's nothing to worry about, and you're not bleeding excessively or anything. We certainly don't need any kind of transfusion or anything like that. Nothing crazy like that.
Can you could do this to yourself, you know? If you had to.
Yeah, I mean, if I had to, it's hard to. I think, what is that? Did you watch that movie Martian with Matt Damon, where he had to do something to himself?
Yeah, I watched
It's very hard to do that if it's because especially if it's like everything's backwards. If you're in if you're looking in a mirror,
Yeah.
it's not. He made it look a little easy. I mean, I don't think I could. A little buzzing noise you're gonna hear, just a cautery that stops little blood vessels from oozing.
Okay.
Alright, I do think you have a lipoma. I'm just trying to loosen around the edge and see then if I can pull it out there. So again, nothing should hurt. Let's see if I can pull that, because I don't think I can push it out. Pop out, nope. There we go, please. Thank you. Let's see if I can get under anything. Down in there. I'm not making it easy for you to see, am I, Valerie? Okay. You sure? Let me see if I can push it a little bit. Oh, can you tap the top again? I see it under there. Can you pull the sides apart like that just now so I can buzz it again? Buzzing again, you're gonna hear. I don't think you can see, okay? Are your fans are going to be so excited that you get this little thing removed? Can you push on that side? Good, thank you. Oh, I see the lipoma there too, so stay just like that for a minute. See it out right there? I think I can get it out here. Let's see. Like I tell my patients, this is the closest, it's like it's crowning, the closest you ever get to having a baby. Let's see if I can push that. Maybe I can push it. Let's see. It's really uncommon to try to push the lipomas out from your head, but I'm going to push on you, okay?
Okay,
Push
go ahead.
hard.
See if you can do it.
I need down the top of it, too. I need four hands. What are you laughing at? That was hard, actually. I couldn't do it. But I almost have it. I want you to push on it. Can you push on the other side, too, Christy? What is so funny? What is so funny? Ah. you can squeeze around the arm, but I can't go on and squeeze you here, you know? You okay?
Uh-huh. I'm alive.
Yeah, you're alive. That's good. That's the way I want to keep it. Please. Look, it's like you don't, it kind of keeps going, huh? This gauze is too close here.
Ooh.
Yeah, it keeps going. Oh, I think I see a little face. Just kidding, I know he was concerned about that. I'm trying to keep it as in one piece as I can so that I can show it to you. It's more dramatic that way. I don't think that's everything, but we will see what we have there.
You got it up?
I think most of it. I think there's still a little bit left here underneath. Usually, the scalp doesn't have too much fat there.
Okay.
But, so this is like a little blob of fat right here.
So it's just fat?
Yeah, just fat.
So if I dyed it properly?
No.
Okay, just checking.
No. You know, like some people have like double chins no matter what, or you know, I think it's just this kind of fat doesn't. I mean, it might grow a little, shrink a little, but nothing significant. Let's see. Just gonna trim to make sure I get it all. Because if there's a little bit left, it can come back.
It's not growing again.
Yeah, see, I think there's still, see how the fat's like a little bit of a different color too? It's more pure, kind of. Yeah, this is it too. There it goes here. See if I can just pull it out. See that? I don't know if you guys care about me talking about anatomy. You know, because it's kind of interesting for people. On our scalp, we have something called the galea, which is like the top of right above the skull. It's like this thin fiber. See, that's the galea. See, if I were to push here, it's hard. That's the skull right there. So if I'm pushing against this, I can feel it knock. Can you hear that knock?
Yeah, that's
kind of
my
knocking
skull?
on you. I'm knocking on your skull right there. Yeah.
Holy cow. Okay.
I don't tell most patients that. I keep it quiet. For you, I'll let you know. Try to make sure we got it all here. I'm gonna turn you back towards me just a little bit. There you go.
You know, like a suction thing that you just stick in there. Suck it up.
Can you pull that up this way? No, there's a suction not gonna really work. Well, the suction is really good for fluids. Just trying to make sure I get all of it. I think it's a little wider than that's why I kind of also use my Sharpie to kind of color up, you know, mark out how big it is, because sometimes you can't see it so much anymore when you start doing the surgery. So I'm gonna move around now. There, see, that's a skull right there. Isn't that cool? I don't know if anyone else thinks that cool, but I think it's cool. Turn towards me. I want to take a good look inside there. Just make sure that there's no holes or anything. Just kidding. There's no hole there. So yours was, yours was satisfying in the sense that I think we got it all. Just want to make sure though by looking all around. See, this is what we normally see when we cut into the skull, into the scalp here, just like this. And there's this little thin fibrous membrane right here, right above the skull, like that. And it's called the galea. Wraps around it. Now I just feel around and make sure it looks nice and flat. Doesn't that look nice and flat now?
Yeah.
Actually, yeah. Okay, good.
So I'm done?
Yeah, I'm pretty much done. I'm just gonna put a stitch there and you're good.
Okay. When you say a stitch, like
a couple stitches.
Sure.
Of course, I'll make sure it's pretty. Oh, did I hurt you?
No, I felt it though.
You felt something? Well, that means it hurt you. I won't do that anymore. I don't need to. Sorry about that.
No, we're good.
Gotta make sure you're alive. Yes. Stitch here. We're gonna put 2 stitches underneath that give it strength. You know, for the long term, you can see his little hair follicles. See the little bulbs right there? Underneath there. So these are called buried vertical mattress sutures. These give it strength. And these get absorbed over time. But I will say sometimes, because I know you're a little bit distant, so you might not come see me for this, but you can always text me. But if you feel like, sometimes these spit out, like about 8 months later, 6 to 8 months later. Sometimes you see like a little whisker, like a white whisker kind of come out, or like a pimple. You know, you think what's going on is, you know, am I getting a little pimple there, or is there something sticking out? It's because your body absorbs them, but sometimes it tries to spit them out at the end. So if you see that, you can give it a little pull. Do that again.
So I don't need to come back to take them out?
Well, you can in about
dissolve.
1 week. No, the top ones are not going to dissolve. It's actually better to use, it's more cosmetic to use top stitches that you can take out. But I think you can take them out too, Emma's, right?
Yeah, don't worry, I got it.
She can take them out.
I'll pop them out.
Yeah, I mean, no, I want her to take them out. Let her have some fun.
She'll be gone.
Oh, you'll be gone in 5 to 7 days?
Yeah, I will.
She's
That's
gone.
right. I think you told me that.
Yeah, she's from England. The gypsy girls are from all over the world.
I know, they are.
Yeah, that's true, right? I mean, most of the girls are foreign, right? Because you're English, Sophia is German, and is Russian.
Well, you were one of the originals, correct?
Yeah.
Yeah.
See that other one of the edges was a little turned down, so I want to make sure. I mean, I'm going to have to look at this all the time now on YouTube, so I better like make sure it's good. So yeah, you can take them out, but if you feel like one in about 8 weeks or so is sort of spitting out, you can send me a picture.
Okay.
And I'll, you know, just to reassure if in case you're not sure.
Okay, sweet.
But you just let me know. So I'm just trying to save you a trip in here, you know.
Yes, ma'am. Awesome.
Of course. I'm sure I'll see it on your vlog or something. I'm taking my stitches out.
Hey, when you do liposuction, doesn't it leave a scar or no?
Really tiny little, almost like you removed a mole. I do it under local anesthesia too, you know, you're awake for it.
Okay.
Very comfortable. It is actually amazing.
But wouldn't you be fine again like 2 weeks later?
No, what happens is, you know, your fat cells just grow and shrink as you gain and lose weight. So if you remove fat cells, they're permanently removed. Just the main issue is that you, if you gain weight, you're not likely to gain it in that area anymore. So that's when people say, oh, well, why am I, you know, they're afraid. You know, I sometimes hear people saying, oh, if I take out this fat, I'm just going to gain it somewhere else. Well, if you overeat, you're going to gain weight. It's not like it's giving you a ticket to never eat. You know what I mean? So I think that's what happens. I mean, I know that's what happens, but liposuction is amazing. It really can make a big, you know, it's ideal for somebody who is actually already in shape or thin. It's not a weight loss sort of thing. It's a sculpting thing. So if you're going to stay the same weight, if you're doing it for weight loss, then you're probably going to slowly gain that weight back again, and then it'll be back, you know? So I think we're doing 3. Actually, I might do 4. Let's see. Maybe we only need 3. Looks pretty darn good if I do say so myself. It does. Let me see. I might want to do one more. Get rid of that little piece of thread there. And right here.
Do you ever, does your work ever require you to put patients to sleep?
No, but I do some like more, almost like a twilight sometimes. When I used to do the major like laser resurfacing before they have the kind of laser resurfacing we do now, which is fractionated, so you know it's not as uncomfortable. They would knock people out, so we would do that. But no, we don't usually do that. That looks good.
I'm done?
Yeah.
So guys, Dr. Pimple Papa hooked it up, okay? And now I have to head home. And you know how your boy heading home, right? What kind of dumbass rides a bike to surgery on his head knowing that he got to put on a motorcycle helmet afterwards?
I did tell you that.
Huh?
I'm keeping this on because it hurt me so bad on the way here.
What, the wind?
Yeah.
Emma using the surgical mask to block the wind. Anyway, stay gypsy.
I should have got the one with like the whole screen.